Good afternoon, everybody. Welcome to our quarterly meeting of SILC and the first of 2024. Wendy is the meeting plus
Yes, hold on one moment. Let me just pull that document up. There we go. So for the roll call, we have Vicky Davis. He is excused, absent today. Vicky Essner. Mary Evilsizer.
Present.
Dee Dee Formaster.
This is Dawn. Dee Dee said she will be in. She may be having connection issues.
Thank you. Jennifer Kane.
Barely made it. My Zoom wanted to update, of course, right as I was trying to join, but I'm here. Nice to see everyone.
Okay. Sabra McWhirter.
Present.
Obioma Officer.
Present.
Kate Ostie.
Wendy, this is Dawn. Kate Ostie has termed out of our council and she is no longer a member.
You are right. Thank you. Cheyenne Pasquale.
Here.
Ace Patrick.
Here.
Linda Voivoda. Julie Weissman Steinbach.
Present.
And Peter Whittingham.
This is Peter. Just a note. I'm noticing that Julie's camera is way up or down. Julie, we're not seeing you clearly. Just showing the back of your head.
Okay, thank you.
Can adjust your camera. Oh, there you are. Hi, Julie. There you are.
Thank you, Peter. Okay.
This is Obiama here. One more adjustment. Could I please get multi-pin so I would be able to pin both of my interpreters?
This is Dawn Lyons. Obioma, I did give you multi-pin, but let me double check and I will do it again. Did you get it that time?
Let me look.
Great.
All right, we're good. Thank you.
What did you say we had one?
This is Wendy. Yes, we do.
Okay, great. So, can you read the preamble before public comment?
I certainly will. This is Dawn Lyons for the record. And for public comment, no action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782 US Tacoma. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments.
Okay, now the floor is open for public comment. Is there anyone?
Looks like Dee Dee is just joining us and she just got her audio working. Dee Dee, we're on public comment. Do you have any? See anyone, Julie?
I don't have any public comment right now.
That's great. I don't see any hands, do you?
This is Obioma. For the record.
Okay.
I want to say that I did get an email from Dawn about an article about the census adjustments that will be happening. So thank you for letting me know about that. And I will be reaching out and speaking with the deaf and hard of hearing community about that. And I've already shared my concerns. I have my concerns with the deaf and hard of hearing community about not appropriately responding in the state. So again, thank you for letting me know, and that we'll make adjustments and add our feedback as necessary.
Thank you.
Julie, this is Dawn. I'd like to make a short public comment if I can. This is Dawn Lyons. I just want to follow up with what Obioma was talking about. I sent it right before the meeting, so not everybody has probably seen it, but the article that Julie shared about how the Census Bureau collects data on the disability community. They have plans to change some of the questions and how they're worded. And so I really encourage everybody to please check out that article and let us know. You know, if you have public comment, you can also give it at the end of today or at the beginning of tomorrow's or end of tomorrow's meeting as well. So, you know, we know how you feel about it and if the SILC, you know, should really have a discussion and take further action about it. So I just wanted to let you guys know that it just came out. I'm sorry for the delay in getting that to you, but hopefully we can figure out where we're all standing on this. Thanks, Julie.
You're welcome. Any other public comment?
I apologize. This is Obioma here. For translation purposes, I just want to make clear that the deaf and hard of hearing community has consistently had concerns about this issue, about appropriate reporting for our needs, and the deaf and hard of hearing appropriately documenting who is deaf, who is hard of hearing, who has a hearing loss. And that has been our ongoing concern from the community. So thank you again for letting me know about this article. We have a way to appropriately give feedback now. So thank you, Julie, for that.
Anybody else want to give any public comment? Okay, I think we're gonna move on. Everyone got a copy of the minutes from the last quarter's meeting in October. Are there any corrections? I don't see no correction.
This is Dawn Lyons. I sent Wendy my suggested corrections already, so I believe she sent out revised after I gave her my suggestions.
Okay. Great. Can somebody make a motion to approve the minutes?
For the record, this is Mary Evilsizer. I make a motion to approve the minutes as submitted.
Do I hear a second?
This is Ace. I second.
Thank you, Ace. Any discussion? All in favor, say aye.
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 So, I'm gonna abstain since I wasn't there. And motion passes.
Aye.
Okay. Thank you, Jenny. Motion passes. Are there any guests here interested in joining the council? I don't see any. And we're gonna introduce somebody with, well, introduce him tomorrow.
This is Dawn Lyons, Julie. Cindy Swanson is joining us if you wanted to re-ask that question. I'm not sure if she's interested, but also we have someone just hired as our youth outreach specialist, but she couldn't come until tomorrow. So we can circle back to this again tomorrow just to introduce her.
Yeah, that's what I read. We have somebody to introduce, but we'll do it tomorrow. I'll ask again. Are there any guests here interested in joining the council? Okay. Can we move on to 5?
Yes, I don't see anyone.
Okay. Now we're gonna have updates from our Centers for Incredibility. Let's start with the Hungary at Southern Nevada.
Thank you, Julie, and Happy New Year to everyone. We're hoping 2024 is going to be a great year this year. Okay, I would like to report that our data is doing well. This quarter, we had a total of 69 new intakes. Of those, 6% were requesting advocacy and legal services. And one of the gentlemen that requested advocacy and legal services, if you'll bear with me, I'm just going to read you his story. It was really an impressive success story. MM is a 59-year-old white male who reports having heart disease and COPD. He was referred to SNCIL by his U.S. Vets case manager. SNCIL assisted him to apply to Social Security Administration for his SSDI benefits utilizing the Special Veterans Program, SVB, to fast track his claim. Through SVB, his disability claim was processed and approved within 4 months with a compassionate allowance flag. SNCIL was able to guide him through the process and gathering his supporting documents. His SSA claim was awarded on November 2003, and he will be getting $2,083 a month. And prior to that, he was almost homeless. And we also helped him to learn about his VA benefits. So as part of our legal and advocacy, the 6%, I'm going to start sharing with you guys stories of people we work with in hopes of letting you know what kind of services we're talking about when we talk about our numbers. Okay, we had for our IL skills training, we had, wait a minute, the next one, is housing. We had about 50 individuals, so about 9% of our services were for housing. We've had a shift in the housing market. Right now, all of the waiting lists, in other words, all of the housing services have been put on waiting list. Everything is tapped out. They are allowing us to continue to process mainstream vouchers. And because we work with the HMIS, that's a software program where we're able to enter individuals right away. They are on the list, but as of this time, housing has come to a standstill. Also with housing, I'd like to share that one of our housing successes was a nursing home transition. We have been working with let's see here. Let's see. We have been working with a 54-year-old female with an early onset of dementia. MH was referred to SNCIL by Nevada Legal Services. SNCIL is currently assisting MH to transition from residing in a facility to living independently in the community. SNCIL worked with MH to be awarded a mainstream housing voucher through the Southern Nevada Regional Housing Authority. MH has moved into her new apartment as of December 23rd. We're so excited for her. SNCIL is currently assisting MH with life skills training, i.e. how to use her phone, budgeting, and meal planning to ensure her successful transition to independent living. And to make sure that our consumers are successful, we don't close out their case. It remains open for at least a year. And then if they need another service, they can certainly get back to us. Okay, moving on with the data and statistics. We had a total of 492 information and referral calls. And then we had 3% preventative services.
I'm sorry, Mary. Dee Dee, would you please mute your line? I think we're getting interference. Yeah, I can mute you, Dee Dee, if you need me to unmute you, just let me know.
I'm hold on, I'm just transferring over from my phone to my computer.
I think I took care of the feedback problem, so sorry, Mary, to interrupt.
That's okay. We also had 3% transportation services, which equals 18 individuals requesting services. We had 3 individuals requesting vocational services, so that was 1%. And then also I wanted to note 1 service request. All in all, we had a total of 713 service requests for the quarter. But I did want to share with you guys one story that we were able to help the individual by partnering with the Assistive Technology Center. And this has helped him so much. GB is a 72-year-old Asian male who is mute due to throat cancer surgery. He was referred to SNCIL by his hospital social worker. SNCIL assisted him connect with the project specialist at the Nevada Assistive Technology Resource Center. The AT Center worked with GB to find an effective iPhone application that would allow him to successfully communicate without assistance of another person. GB and the AT group worked with the cell phone provider, T-Mobile, to install an IP relay to his phone and to train GB how to use it. GB has been using his technology with success. He can now do his telemedicine appointments, and for him, he's so excited. It's like he has brand new freedom in his life. So just sharing with you what's happening with our consumers. Appreciate your listening to that. And then moving on with my report, it looks like we're going to get started with the DIF project. And I'm not going to say too much because I know Jennifer Kane is here. And I know that the SILC is involved in that through Don. So we're all excited about in 3 years having a website for our youth to transition students. And I think it's going to be for everybody. And then I think that the phone app is going to be phenomenal, a wonderful way to reach the young populations. And then the chart for the parents to know what age to reach out for what service for their child is going to be amazing. With that, I'd like to report that our Disability Awareness Day, excuse me, I've got allergies. Disability Awareness Day was a success once again this year. We got very good ratings on our satisfaction surveys. One individual did ask it next year if we could have more elected officials having booths at the affair so that they could provide input, and we're going to be working on that. I think it's a great request, so we will work on that. And I want to thank Dawn again. Through Dawn, we were able to connect with the let's see, the WIPA program. And the WIPA is the Work Incentive Planning Assistance Program. While we wanted the individual to share information with us by Zoom, that didn't happen, but we were able to connect people with her right away by phone. And that's a big event because it's hard to get through to services, hard to conduct services. So thank you again, Dawn, for that. And then we'll try again this year to see if we can get her to fly down. So that was good. And I just wanted to give everyone heads up. Right now, we're working with the City Council to have DAD, Disability Awareness Day, next year on Saturday, October 5th, or Saturday, December 19th. Saturday, October 5th, or Saturday, October 19th. The April conference is the 11th through the 13th. And we know that many of the SILC members and a lot of our consumers like to attend that conference. So this way there won't be a conflict of interest, and it'll make it great. And April is going to be, I think, in Chicago this year. So ought to be exciting for those that go. Okay, so that's my report. And just one final note I wanted to make. We are reaching out right now to the Veteran Stand Down group that's going to be promoting the function. Last year, and we weren't complaining or anything, we did it in the most dignified and graceful way possible, but they had a lot of barriers for individuals with mobility devices, and some to the point that were dangerous even for individuals that did not have disabilities. So we have volunteered to work with them if they'll just allow us, before they pick their venue, to help to guide them to make it the most accessible function possible. Essentially, a lot of our veterans have disabilities and they have barriers to begin with. So we like to see events and activities out in the community being as accessible as possible. The other note I'd just like to make, I would like to say kudos, Peter. I've been keeping an eye on your events and have tried to attend some of them. You've got the art of public relations and putting on great events down to a fine art. And you are someone that we're proud of in our community. So with that, that's the final report. And if there are any questions, I'd be happy to answer them.
Thank you, Mary. I really enjoyed this illustration. It really gave us a picture of what you do. Thank you for that.
Thank you for listening. It's my pleasure.
Dawn, you have your hand up.
Yes, thank you. This is Dawn Lyons. I also agree with Julie. I really appreciated the small vignettes that you provided. It's really important to hear those individual stories, and it makes all the difference. It really makes us happy to hear that SNCIL is affecting the community in such a positive way. The one thing I wanted to mention also was that the veteran stand down, I appreciate you giving them that feedback and you offering your assistance in that way. I know even myself, I got there and I planted myself in my chair because I was afraid to move around myself. There was so many rocky and bumpy areas. So thank you for that. And then the last thing I wanted to mention was the Employment First Coalition would really like to work with you for next year's Disability Awareness Day to coordinate an employment fair. And I'm not sure if we want to do it at the same time or if we just want to coordinate, you know, combine services and partner on it and do it at a different time, but we'd like to have more discussions with you behind the scenes on that.
No, we are very interested in that as well. And then, but now we have time. I think last year we ran out of time because it takes a lot of time and thought for the venues, what workshops we want to have. And job fairs are so critical for our consumers that if the more that we can get into, I think I have a great location for us this year. If we get started early, it's one of the libraries. I worked with both rehab. I was actually a presenter at, we did a workshop on just training counselors how to work with people with disabilities. Not that they need it, but from the consumer's perspective. And they loved it, and so did the consumers. But it was a library that has ample room for everything. So Don, I'm going to try to dig up my records, and then maybe you and I can contact the library ahead of time and say, we're going to be coming down the road with this. We don't know just when, but at least we have a venue, and then we can move forward.
Thank you. Sounds good. I'd like to talk to you more about it.
Okay, thank you.
Is there anybody here from Northern Nevada? Yeah. I don't see Lisa.
Both Lisa and Mark were here. I see Mark.
Mark, do you have an update?
He may be trying to unmute himself. If he's raising his hand, Mark, can you unmute yourself? Again, it might be the wind issues up north. Mark, if you can put something in the chat to let us know what if you're having issues with your sound or if there's something you need to say. Can you do that? Oh, he can't unmute. I will prompt that again. I'm gonna. Oh, it's not letting me. So I'm prompting him, asking him to unmute, and it's not allowing me to do that. So it may be a connection issue of some kind or some kind of glitch.
Mark, can you try logging out and logging in? And in the meantime, we'll go to Dee for the Rural Center for Independent Living. And then we'll come back to Mark. Dee Dee, you're muted.
Hi, this is Dee Dee Formaster for the record. Let's try this again. We have been very busy, mainly because Sandy passed away. Sandy Coyle passed away on November 14th. So she was
Dee Dee, we can't hear you.
Sorry. Just give me a sec.
Yeah, no problem.
She was our grant writer. She did all our payroll. And she also was our grant administrator. So we've had to hit the ground running. So it's been difficult at best. We had a lot of people coming in for services, mainly because cold weather is starting to close in now. And a lot of the people who are here in Carson City, Lyon County, Story, and Douglas County have been dealing with the extremely cold temperatures. So we have been working very hard to get people off the streets. We worked with a gal who was out of the Lyon County area who has been in her car for over 4 months now. She has been in the car with her 3 dogs that she loves very dearly. But we worked with her and scoured around and managed to find her a wonderful apartment in the rural Douglas County area. And she got into housing on December 23rd. What was really wonderful is that the people in her apartment complex wrapped their arms around her and showed up with a bed and other furnishings, food, all of her kitchen supplies, and towels, shower curtains, and everything else to help her be more comfortable, which was absolutely wonderful. And it's just amazing what a community can do if they're aware. And so they have also invited our support group to use their community center in the Douglas County area. So we will be doing that once a month, which is really wonderful to be able to have that opportunity to reach out and have a gathering area there in the Douglas County area. Also, we are working with other alternatives as far as housing goes in our community. Spoke with the mayor last night at a forum which we attended, and about resources in the community. And we were able to talk with her a little bit about individual dwelling units and the city legislation that we have been working on to get those instituted in the Carson City area. So the district attorney, unfortunately, has been ill, so he has not been able to bring back the information to get it passed through, but it looks like it's going to be a permit program, which will make it easy for people to be able to do this, and will hopefully allow our aging community in the Carson City area to be able to institute individual dwelling units in their backyards a lot easier, which will help with housing. Also, our 192 unit housing complex, which is being built right now on Butteye Way, should be opening by March. But the only problem is that only 20% of that will be low-income housing. The rest of it will be working poor. And so, but 20% is better than nothing. Also, I am still working with the mayor on hopefully making things easier for us to be able to have diversified housing, which is what I'm really shooting for. Once I get things implemented in the Carson City area, I'm hoping to be able to move out to the Douglas and Lyon County areas to get their board of supervisors on the same page as we are in Carson City. Let's see, we also are working with the head of welfare to be able to partner with them on Friday afternoons at the Carson City Library, where a lot of homeless hang out, to be able to connect them up with resources and services. They already have a worker there from welfare who is absolutely wonderful. His name's Richard, and he has the patience of a saint. And has worked extremely well with our low-income people, as well as people with disabilities, and people who are on the streets with disabilities in our community. So we have that resource coming up in the new year. So that's about all we've been up to, which is a lot.
Yeah. Thank you, Dee Dee. Any questions for Dee Dee?
This is Dawn Lyons for the record. I would like to let Dee Dee know that Jennifer Kane has mentioned in the comments that she's so sorry for your loss, Dee Dee. And I would like to also, express my condolences. I know Sandy was also your sister, and so it's a big loss for you and your son. And I'm very, very sorry.
Yeah. They said it's late. They said it's a very pure blessing.
What was that, Julie? I'm sorry.
I said, may Sandy's memory be a blessing. I was so pleased.
It certainly will make us work all the harder to make sure that we keep her legacy alive.
Yeah.
She did a lot of great work, especially dealing with advocacy in the area of the schools. Thank you, everybody, for your concern.
Thank you for your report. Mark, what are you able to figure out?
This is Dawn Lyons. I still am having the same issue. I can't, the button that says ask him to unmute will not click. So he's having some kind of a glitch problem with Zoom. But I didn't see him disconnect and reconnect. I'm not sure if he's able to do that either. Like I said, there were high winds happening up north, so it may be an issue, a technical issue.
I'll work that report, and we can do it to first thing tomorrow. Is that acceptable?
Mark, you can put your reply in the chat if you'd like. If you think doing your report first thing tomorrow will work.
This is Dee Dee Formaster for the record. Yeah, the reception is very spotty here in the north. And we have really high winds and snow.
Well, Julie, I guess we will revisit tomorrow and find out.
Okay, great. Okay, we're gonna move on to updates and discussion regarding the Nevada State Rehab Council.
So this is Dawn again. I did not see Raquel. She may be here tomorrow. As she was going to make the announcement, but I'll just let everyone know tentatively that, I'll let her make that announcement if she's here tomorrow, but she has had to step down to pursue other career options at this time. So she is going to try to be here tomorrow, and she'll let everybody know what's going on with the Rehab Council and everything then. If not, I will let everyone know at that time.
Okay. Cheyenne, can you give us updates about the aging and disability services?
Sure, thank you. Cheyenne for the record. There was an attachment added to the meeting materials midday yesterday, so I apologize. It wasn't quite as quickly as I wanted to get it posted, but it was the day before the meeting, so I'm counting that as progress. We have a couple of updates. So first, wanted to talk about a couple of projects that we've talked about in the past. So one is our No Wrong Door project. So since 2005, Nevada has joined a number of other states in trying to develop a no wrong door approach to long-term services and supports. And a lot of our efforts have focused in on resource and service navigation, helping individuals understand long-term service and support options, and supporting people in accessing various different long-term services and supports. So last year we received a grant it was actually in 2022, we received a grant. It's a 2-year project to help the state sort of reset those efforts. And so the first year of the project was focused on mapping access points and really doing an analysis of like where people access long-term services and supports. We do have the final report for that activity, and we'll be publishing that on our website, hopefully in the next week. And so we'll send a link out to that. And then the next phase is really developing our plan to further our efforts in line with the Administration for Community Living's definition of no wrong door. So it'll be like our no wrong door implementation 2.0 is how I think about it. We've had a number of challenges. I've been working in the no wrong door sphere for a long time. And I would say that there's been a number of challenges over the years, but there's a lot of opportunity and a lot of good conversations happening now. So we're excited about that. I think a lot of this work, we saw the importance of it in our Olmsted plan in terms of ensuring that people know about different programs and services that are available and can be supported in accessing those programs and services. So our work is paused temporarily on the No Wrong Door project because of some state contracting issues with our facilitator, which is the Nevada with University of Nevada, Reno. So we're working through those, and hopefully we'll have more information to come. The Olmsted plan was finalized in September, and thank you to Julie for your participation on our steering committee. We are going to create a page on our website where the plan will be posted along with some of the materials that were developed throughout the process, including like summaries of the public comments and things like that. I'm working on creating an initial baseline report that can be published to help us further define benchmarks throughout the plan implementation. So it is my goal and intention that this existing ADSD Olmsted plan becomes a living, breathing document, and that we'll have, annual updates and things will change as we progress through the plan. So. And then finally, the current project that I believe I've mentioned in the past is the ADSD outreach project. So we received some funding from the governor's office under the ARPA allocation, ARPA, sorry. And the goal of this project is to really rebrand the Aging and Disability Services Division, make the services and programs that we have available through our agency more visible to the community. A big piece of that is working on our messaging to make sure that it is relevant to the general public and to the individuals we serve. And then also the really big piece that I'm most excited about is looking at revamping the ADSD website and maybe modernizing that a little bit. So making it a little bit easier to find information and navigate through the website. So we have had our initial conversations with our vendor and those have been really focused on getting to know the different programs and units within ADSD. And then have a meeting next week to look at what that project plan is going to look like and kind of solidify our approach going forward. So there will be more information to come, and we've expressed the desire for the vendor to have some community feedback sessions, particularly as we get involved in the website design, to be able to have user experience inform that website development. So we're excited about it, and going to be hitting the ground running hard here in the next month or two. So I'm going to pause for a second. Those are current project updates. Are there any questions on those?
I don't see any hands.
Good, I don't either, so I'll just keep going. We included a section this time that I called the Regional Coordinator Report. And what we wanted to do is just kind of highlight some of the focus of the different community conversations that they have been having with various stakeholders across the state. And we highlighted 3 areas that have really come up across the state, regardless of which region the coordinator is representing. And I think a lot of these are probably familiar to the SILC here. I'll just kind of go through it quickly, and then I'll offer an opportunity for Autumn or Lori to step in if they want to add anything. So the first area is transition services. So there's been a lot of community conversation around transitioning out of hospitals, as well as, transitioning out of hospitals to their home or to long-term care facilities. And there's some real challenges across the state, particularly, I think, from the housing shortages. And so then as people maybe transition out of the hospital and maybe they don't have a home to go to, there is also that lack of capacity within homeless shelters to support individuals with disabilities. There's also been a lot of conversation in terms of transitions for people with disabilities out of the school system. So as they graduate or age out of the school system, and how can there be stronger support in those transition services. One of the areas of opportunity also is benefits planners. So supporting individuals in planning for benefits. And Lori and Autumn, please correct me if I'm wrong, but I think also looking at, like, if a person has certain benefits and they start to go to work, and how does that impact their benefits. So I know that our developmental services team has a pilot for benefits planners, but in our Olmsted plan, we also recognize that there's a need to broaden the availability of benefit planners across the state. And then the third area of transition is for individuals who have a dual diagnosis of a disability and a mental health condition, transitioning out of jails and prisons. So needing some support in those areas. And then housing, right? We've heard housing issues time and time again. So those are some of the things that we've heard around transition services. I'll pause real quickly. Lori, Autumn, did you want to add anything? Okay. The second area is really just the availability of services for people with disabilities under the age of 60. In particular, looking at the need for to strengthen transition support, food and nutrition, and then support for individuals living with a dual diagnosis of intellectual and developmental disabilities and mental health conditions. Again, housing, and then awareness of services for children in the school system, and the lack of specific funding for services for people with disabilities. And then the third area that's been really talked about a lot across the state is our provider gaps, right? So wait times for getting a Medicaid provider to come into the home to provide services. We know that that's a challenge for our waivers and for our state plan services. There are several barriers and challenges for people becoming Medicaid providers due to requirements in the paperwork, the lack of providers in rural areas, transportation funding for providers in rural areas, so being able to support the increased costs related to providing services in rural areas. There's been quite a few conversations around providers for jobs and day training or disability-friendly employers. And then also services for survivors of domestic violence who have a disability. So I think the provider gaps is one area that's really challenging for ADSD as the operator of the waivers, right? We have limited authority or capacity to change the Medicaid rules around providers and requirements. And so I know we have had quite a lot of conversation with the state Medicaid agency and shared concerns that we're hearing from the providers. But it's a big beast for the state Medicaid agency in terms of trying to improve provider relations. Dawn.
Thanks, Cheyenne. This is Dawn. I just wanted to ask, I've been hearing some feedback about renewing people who need to renew their waiver services and being told that they're probably not going to be approved for as many PCA hours. And I was wondering if you heard anything about that through Medicaid, because, you know, I know that it's kind of a dual eligibility process between aging and disability and Medicaid. You haven't heard any changes that took place, have you? Or the reasons why that could be that they're being told that?
No, I haven't, but I'd be happy to follow up with our waiver folks and see if we can't get some clarity and we could send that out to be distributed after the meeting.
Thank you.
Yeah.
This is Dee Dee Formaster for the record. I just wanted to say that in a lot of states, money follows the person is connected in with CILs.
Mm-hmm.
And I do want you to know that we are here to help you. We are already set up. We have lots of good, strong staff that is very much aware of the needs of independent living. And we do want you to know that we are here to help. So if you would consider letting us assist you with money follows the person, that would be terrific. A lot of CILs have, in a lot of states, have been able to actually utilize the extra money to shore up their centers for independent living. And I think that personally, maybe you should take a look at what the other states are doing in this area, because it's quite fascinating. As I've traveled around and spoken with other people from other states, the money follows the person program is interlinked with CILs. Mm-hmm. And also, I do want to bring up the extreme need for people who are providing all of the wonderful wonderful services that are happening out there in not only our rural areas, but in places like Washoe County and also Las Vegas. The providers are not being compensated like they need to be. Wage-wise, it's terrible. And the reimbursement that they get for mileage is not great either. And it is so needed in the disability community to have good providers. So we really need to try to, shall I say, invite people with better wages, and so that we can increase the staff in that area. Thank you so much for your time and the hard work you put in every day. I appreciate it.
Thanks, Dee Dee. And you led me right into the next part of my report in terms of MF, the money follows the person. But before I move on, I would like to, I see Mary's hand up.
Oh,
And
thank
I
you,
don't see it,
Diane.
but oh, there it, okay.
Sorry, I wasn't sure if this was time for questions or not, but I saw you answering questions. I just have 3 points to make. The focus program was here, and our center used to partner with them in providing preventative services in the community, preventing individuals from going into the nursing home, and actually also assisting individuals transition from the nursing home to the community. And did the focus program go away?
The focus program did not go away. It transferred to ADSD in the last budget cycle. So focus and money follows the person have been transferred to ADSD. There's currently no staff in the focus program.
Okay.
So we are working on recruiting to hire those vacant positions, and at the same time looking at how the program operated when it was under Medicaid and what opportunities there are to expand and strengthen those efforts now that we're going to have a whole brand new team for focus.
We really appreciate being able to work with them. They were one of the most effective resources we had to partner with, because for the institutional transitions, it takes a village. It really does. We would have some funds, they would have some funds, but all together we would find the housing, they would get the Medicaid waiver. We were working so well together in that capacity. So I'm glad they're not gone. And then also I wanted to mention that here in the South in Las Vegas, thanks to Lori Tutu, who is doing a great job connecting our center with some really wonderful resources, we connected with the Money Follows the Person program, and we had an in-service, we exchanged information as to what we each do, and we have plans in January to strengthen the partnership and to see how we can support, you know, each other in with the institutional transitions. I don't know if they can work on preventative, but I don't think they can, but they have access to something that we really need to help individuals, and that's the waiver program. So we appreciate that they have quicker access than we do. So appreciate that, and appreciate Lori for doing that. And thank you, Cheyenne, for all that you're doing. And thank you for working on the PCAs. We have individuals that are moving out of the state of Nevada because right now the resources, we just do not have them. We just don't have personal care attendant services. They're having to move back home where they have natural resources. But that's not to say every state has that crisis right now, but it behooves us all to do the very best we can to improve those services. So with that and the waiver program, if we could get more slots, that would benefit all of the individuals that we work with in so many ways. So anyway, thank you for listening, and thank you for your time, and my apologies if this was not the appropriate place to ask questions. Thank you.
Nope, I purposely paused throughout my little sections. I build out those pauses, otherwise I could fly through this super fast and thank you guys, both Dee Dee and Mary, for those comments. So I wanted to talk about two new projects that we're working on. So one is what I'm just loosely calling disability supportive services, and like I would like to have a much better name for that, but for the purposes of today, that's what I'm calling it. But we received some additional funding from the director's office under Title 20 of the Social Security Act, which is to be used for supportive services. We have decided that we are going to be targeting this funding to support programs that provide social services for people with disabilities specifically. And the Title 20 funding, I'll finish this sentence real quick, Dawn, is geared, it has kind of 5 broad goals. One is self-support, self-sufficiency, preventing neglect, abuse, and exploitation, preserving families and community-based care, and then institutional care. Based on our known gaps, we are looking at targeting services that fall under the self-support goals, the self-sufficiency goals, and the community-based care goals. We're going to have funding available for ongoing programs as well as one-time infrastructure projects. And we have approximately $1 million available for projects each year. So I will pause there because I didn't see Dawn's hand up before I started chatting on this one, but.
Sorry, this is Dawn Lyons. I was actually going to ask if we could revisit because Sabra had to jump off for a minute and we lost quorum.
Oh,
but she was coming back. So I was like, but she's back already. So I just lowered my hand because it's no longer relevant. I'm sorry to interrupt.
No, that's okay. My apologies. I didn't pause right there. So, so we're very excited about this, and this is something we have been working towards for quite a while, and we are hoping to get that notice of funding opportunity. Not hoping. I am going to get this notice of funding opportunity published this month, so that we can get some projects started in this realm. You know, it's not very often that we get an extra $1 million to put out into the community. We're purposely knowing that there are a number of gaps and service needs, particularly for people with disabilities. Where our thought, and I'm welcome to suggestions and thoughts from this group, but our thought is to keep it more broad within the confines of the funding source, you know, and putting it out to the community to see what types of projects we get back, so we can see where there's some real needs and real opportunities. And then as we go through and hopefully continue to receive this funding, be able to like formalize programs and services to meet some of these gaps. So that's kind of our thought with it, but I'll pause. I see Dawn's hand up.
Thank you. This is Dawn Lyons. While I agree that it's a good idea to leave it open to the community's availability to cover some of those resources that are needed, I also think that it's a good idea to maybe provide like extra points in the evaluation for specific services that are especially needed in the community that maybe can encourage providers in a certain direction for things that we know that we have real data on that we know we need. Like for instance, you know, I mean, I know housing is a big issue and that we're not a housing authority necessarily, but maybe surrounding housing issues that we could provide additional help and support, like from what Dee Dee was saying with, you know, extras that aren't considered, you know, when we're housing someone that they may also need, or things like that, or, you know, perhaps even additional PCA hours, or, you know, I know the provider shortage is real. And I know that we're working on that in the behind the scenes, but you know, that I guess that's my take on it, and that's just my 2 cents. And I'd like to let other SILC members add their own ideas.
No, I appreciate that. I think it's an excellent idea. Is there anybody else, because this, I'm super excited about this, this funding and this opportunity, but does anybody else have any thoughts that they would like to share about this funding opportunity?
This is Dee Dee Formaster for the record. I just really want to express that all of our CILs are staffed, we're ready to go. So please think about that, because partnerships are so important in helping the disabled community. The more partnerships you have, the better the disability community is going to do. And we desperately need resources and assistance for things like PCA services and housing resources is a big, huge thing because it's stopping a lot of the transitions from the nursing homes. A lot of people are ending up in group homes and nursing homes that would rather live independently, but they don't have that opportunity. And so it's difficult for them. And I just really want you to know that we're here.
Yep.
So thanks so much.
Thank you, Dee Dee. Mary?
Thank you, Cheyenne. I just wanted to give you a little tip that took me years to learn. As we were doing the nursing home transitions and as we were doing institutional transitions, we worked with HUD a lot. And then HUD at one time put out a grant to help community partners transition individuals. And they did a study, I don't know where it is, but they came up with the figure of $3,500 per individual for a solid transition. And we started using that figure, and we discovered that that would be what would cover the deposit. And then you don't think about things like the deposit for the keys, and then the startup home supplies. And then there's always a need for a bed, a little table, and the microwave. And yes, we would buy TVs for them. For some of our consumers, that is like the only means of socialization and entertainment that they would have. So it was a holistic project where we were looking at the individual, and clothes were in there as well, because they didn't have those to start out with. Anyway, that's just a figure, Cheyenne. If you ever need to just yank a figure out for a project, you have that in mind. And
Yeah.
that, you know, it's covering it. But with the economy, the way it's going, you know, that just that first month's groceries has increased so much. So anyway, just a little tidbit. Thank you.
No, I appreciate it. Okay, so that brings me to money follows the person. So I put this in here as a new project because when the program transferred to ADSD, which happened through the legislative process, we also had to do a bunch of work over the last year or so with the Centers for Medicaid and Medicare Services, or CMS. And so they're really looking at our transition and with ADSD being the grantee for Money Follows the Person as a brand new program. So within the federal regulations or guidance, Money Follows the Person has this very technical document that's called the operational protocol. And this is a standard template that is used to detail how the program will operate in the state. The template itself, with no information in it, I think is, well, it's very thick. It's like around 50 pages, just with no information, just the required sections of the operational protocol. But what I'm doing is working with our project director. So her name is Kelly Nash, to develop our plan in terms of how we are going to get stakeholder input in the development of the program for Nevada. So kind of starting over, not completely with a blank slate, because we have some pieces that were in place that worked really well, but we also recognize that we have some opportunities to strengthen the Money Follows the Person program. And that could be things like looking at what is the average that we have available for transition services, right? How do we engage in some efforts around provider development, etc. So we are probably looking at like a mid-February where we'll start to really work within the operational protocol and have a number of different opportunities for conversations with the community to help us design this program and how it can best meet the needs of people that are looking to transition out of facilities. We do have a very small goal. Every year, every grant has a goal for transitions, and so we set a very, very conservative goal of doing 15 transitions in 2024, and that is with the assumption that it'll take us probably 6 to 8 months to design the program, get contracts in place, etc. So that's where we are with Money Follows the Person. So I appreciate the comments today, and just want everybody on this call to know that the SILC and the CILs have been top of my mind since we transitioned the program, and I definitely believe that there is some real opportunity for partnership to strengthen this effort in Nevada. So those are, and then, I do have 2 other just quick things that I did not put on my handout. One, I wanted to invite the SILC, and I don't know if that would be a SILC member or if you would want to delegate this to Dawn, but I wanted to invite the SILC to our Nevada Lifespan Respite Care Coalition meeting to just have some general discussion around family caregiver supports and respite services and some of the priorities that the SILC is seeing in relation to having some of the priorities that the coalition is seeing. And I'm also inviting the DD Council. So I wanted to throw that out there for conversation. And then I probably should have mentioned this in agenda item number 4, but Don did let me know that it's time to look at the DSE representative, the appointed member from the governor's office for the DSE representative. I think I've termed out or getting close to terming out. And Lori Lutu is gonna apply to be our DSE representative appointed member for the SILC. So I wanted to mention that. And then I guess I should circle back because I did ask the SILC a question about the Nevada Lifespan Respite Care Coalition meeting. If somebody would be able to attend that meeting, it's.
Cheyenne, this is Dawn Lyons. I think Mary Evil Sizer had her hand up before you asked that question. I don't know if she had something to ask previous to that.
Okay, thank you. Mary, go ahead.
You're muted, Mary.
Thank you. Cheyenne, I did want to offer at one time, the Money Follows the Person program had a memo of understanding with the HUD Housing Authority. And what it was, there had been a lottery at one time where there were some housing vouchers that went just for individuals that were institutionalized. As I said earlier, Money Follows a Person in the South and RCIL are going to work together. If you would like, I could start the research. It is going to take the state to do something like that. I can't apply for it, but if we can find out what's going on with that. Again, in the independent living movement, we don't ask for special services, but we want equal services, and that's equal access. So if we could get that going again, I know for about many, many years, our center would always write a letter of support to support our state agencies in fast tracking individuals with disabilities into housing. So we can get that going again. And then that's what I wanted to say to that. And then you did skip on to say Lori Tutu would be applying for DSE, and I'd like to say congratulations, and that I've gotten to know Lori Tutu, and we've enjoyed working together. She took the initiative to set up a booth at Disability Awareness Day, and she is doing a great job. I'll get an email saying, Mary, I'd like to introduce you to, and then I follow it up and then we're oh, okay, we're going to be working on this and this together. So that's all I wanted to say, Cheyenne, and congratulations, Lori.
Thank you, Mary. I've enjoyed working with you as well.
Thank you, Mary. And I do have Kelly. She is connecting with the housing advocate at the Nevada Division of Housing to start some of those state level conversations. So, but we will definitely reach out if we need a little bit more history and background.
Just let me know what you need.
Thank you. Autumn, I see your hand up.
I will go when you're done. Did you get everything done that you needed to get answered?
I think we just need to have a little bit of discussion around the Nevada Lifespan Respite Care Coalition invitation.
Okay, I'll pause.
Dawn, didn't you go last year?
Could you repeat that, Julie? Sorry.
Dawn, is that the conference you went to last year?
Which conference?
The one that Cheyenne
Are you talking about the Nevada Lifespan Respite?
Yeah, yeah.
I don't think it was a conference, was it, Cheyenne? Was there a conference?
Not that I recall, but
whatever. The meeting that Cheyenne.
So that's the discussion that I sent out to SILC members to ask them to consider and think about what kind of feedback they'd like to give to Cheyenne about. And then what I had said in what my thoughts were about it, and I'll just share that here as well, is that I know that the SILC had Medicaid present on the reporting or on the process for reevaluating rate increases or rates in general. And when they presented their findings and their methodology, I had questioned how they, if they had thought about improving those methods, because they only had, like, I think it was just a very small handful of responses on their surveys for out in the community to the providers. And so it really didn't seem like valid data to me. And so they said that they would be reviewing their process because it really wasn't informing them properly, in my opinion. And I know that the SILC kind of felt the same way when I mentioned it at our meeting that time. I think it was last year sometime. I don't remember which meeting. But when I asked them about it recently too, during one of their forums, and I believe that was like maybe November or October, something like that. I don't remember what the forum exactly was about, but I had mentioned that and asked about whether that rate review had, or the process of the review on how they determined their rates if they had come up with any answers or better solutions to that, and they said it was still under review. And that I thought it was important that maybe the coalition might want to partner with us on speeding along that process and getting some answers from Medicaid about whether they've reevaluated yet, or if they plan on reevaluating, or how they determine those rates, because that's really the biggest issue in our state. And so leaving it in the hands of 2 or 3 providers out of the whole state is really doing a disservice to the whole state, in my opinion. So I don't know if anyone has other
I think
thoughts.
a lot of us had this similar concerns.
Not sure. Looks like the captioner didn't catch that either. Julie, can you repeat?
I said, I think some of us had similar concerns.
This is Dee Dee Formaster for the record. I have extreme concerns over the pay rate. And the fact that in doing PCA work, you really need to be paid for it. And I don't think that the pay that they are making, which I'm not exactly sure how much per hour, but I am sure with the fact that the wages are horrible. And people cannot live off the wages that are being paid, let alone, in the rural areas where they're having to travel long distances and in horrible weather, horrible road conditions in the wintertime. The wages just aren't even worth it. And I think that the people who are doing the PCA work right now need to be commended for the fact that they truly have a heart for it. Otherwise, they would not be doing that kind of work, because they're certainly not getting compensated wage-wise. And as far as I'm concerned, it's getting to the point where I think they need a union. So it's getting that bad. And I think that they desperately need to be compensated for the work they're putting in, because it is not easy work. I know, I've been a PCA.
Take it
Thank
easy.
you.
Cheyenne, I think your request got lost. Can you repeat what you were asking from us?
I'm really just wanting to invite a member of the SILC to the next Nevada Lifespan Respite Coalition meeting to talk about caregiver support, and particularly the coalition is more focused on family caregivers or unpaid caregivers, and any and have an opportunity for the SILC to highlight any priorities or issues that they're seeing in terms of family caregiver support as a means of just cross sharing information between our advisory bodies. Don?
Sure.
So this is Dawn Lyons, and I think I know what you were talking about now, Julie, because I went to the self-direction conference last
Yeah,
year.
it was something.
So now,
Sorry.
sorry, it took me a minute to remember what you were referring
I'm
to.
sorry.
But I do think it would be important for one of us to be at the coalition meeting. Can you tell us when that is exactly, Cheyenne?
Yes. I don't have it on my calendar, but I'm 99% sure it's on January 22nd. And I believe it's 9 o'clock.
So this is Dawn Lyons, and since I did attend a self-direction by myself, no other SILC member did, and I understand self-direction. And you know, I also understand quite a bit about the state of Nevada's buy-in to self-direction recently on the HCBS waiver. And I guess I'm probably feel like I'm informed enough to participate in this conversation. If everyone else is okay with it, I don't mind. I am free the morning of the 22nd, so I can attend that. I am out that afternoon though, so if it's later I can't go, but
Yes, if there's no objection, yes, I'd like to ask Dawn to be our representative.
is there anyone else? Sorry, this is Dawn Lyons. Is there anyone else who would like to instead? Because I have no objection to anyone else who's feeling passionate about this to attend instead. Okay. I will go.
Thank you. And it is, Autumn corrected me, it is at 10 o'clock, not 9 o'clock. So we'll get you in a meeting invite. Thank you, Don.
Thank you. Do you have any other updates, Cheyenne?
I mean, there's probably a ton that come off the top of my head, but I do, Autumn from our Washoe regional coordinator, she had one thing that she just wanted to add to the conversation.
Okay.
Thanks, Cheyenne. Thanks, Julie. This is Autumn Blattman for the record. I just wanted to mention ADSD is putting on a conference in April, and I'm sure we've probably announced it a million times to you guys already. But I wanted to throw it out there again. The conference is going to be the 16th through the 18th of April. The 16th is a half day directed towards professionals in the aging and disability community who receive funding from ADSD or a provider contracted with ADSD or Medicaid. But the other 2 days are open to anybody who's interested. I'm really geared towards, again, professionals in the community or advocates and individuals working with older adults and people with disabilities. But we are looking for speakers as well. So if you're interested in submitting a proposal, we have a quick little form to fill out for a speaker opportunity if you would be interested. And I'll put my contact information in the chat. You can just reach out to me and I am happy to send it out to you.
And this is Dawn Lyons. Just for the record, if any SILC member would like to collaborate on a presentation or have a suggestion for us, they can reach out to me as well, because I can coordinate that Aging and Disability Services.
Right.
Something else just I'd like to mention here is that Sabra said in the chat, Sabra, you know you can talk, right? You're a SILC member, but I'll read your chat anyway. That she said that would be great, Dawn. I wish I could, as I'm a family caregiver and we need so much assistance. I wouldn't be able to get off work anyway. Thank you, Sabra. I appreciate that. And I know that you have a lot on your plate. So, and one last thing, sorry, Obioma, I also want to say welcome, Lori. I'm really happy to, you know, if as long as the SILC is ready to give you their endorsement for a designated state entity for us, I appreciate that you are willing to come on board with us and be that representative. So thank you.
Thank you, Dawn.
Obioma.
This is wonderful. This is Obiama here for the record. Thank you, Julie. So I just wanted to say that I plan to speak to Lori Lutu about presenting at the ADSD conference. So if anyone on the SILC would like to co-present with me, that would be great. And I would like to present on 2 separate topics. One, we'll talk about the community members, what to do with the certification for that. No, I will be with community members. And the other one I would like to do with another SILC member.
Thank you.
But everything's going pretty fast, so we'll see. No, so I'm working on getting
approval.
I'm in the process of getting approval. All right, thank you.
Thank you. There's Jennifer.
Thank you. This is Jennifer Kane for the record. We received the email through the listserv, the NVAT Council listserv, regarding the conference. We are interested, a few items down, I'll be presenting about the Disability in Nevada Department of Education's Disability Innovation Fund Partners to Pathways Model Demonstration Project. And we thought it might be nice. We have 9 under innovative collaboration, which is one of kind of the strands. And by the way, we love your Star Wars theme for the event. The Force Awakens, Nevada's Services Saga, may the change be with you. I was like, oh, I want to just go just based on that alone. But we have talked about, honestly, that it would be really cool to do some kind of a collaborative presentation under that innovative collaboration strand. I just don't know if we're going to make it by January 17th because we are like at the upstart of the grant and we are right now drowning in meetings and paperwork that is due. And so know that it is on our radar at the Department of Education. But we don't have like our next meeting with our partners till January 23rd, which is after the 17th when it's due. So I think because of the timeline, we might be out, but just know that if we don't do it this year, we would definitely be interested in doing that in the future when we have things a little bit more up and running than where they are today, which you'll hear about in a little bit.
Thank you, Jennifer. And we can certainly have Autumn reach out to you and talk a little bit further.
Can we go in cosplay?
I'm not setting any rules. You wear what you feel comfortable in.
I think if there's no more comments, we'll show you ahead. Which I don't see. There's a bunch of us standing a break. So it's 2:49.
Thank you. I did not mean to take up so much of your time today.
No problem. All good information. It's 2:40 now. Let's take a 10-minute break. And we'll be back in 2:50. Wendy, do we have quorum?
Yes, we do.
Okay. I want to backtrack just a little bit. First of all, I realized that I skipped over the record regarding assistive technology. And maybe John will join us tomorrow. Correct, Dawn?
Yes, this is Don Lyons. John did let us know that he had another meeting to attend today and that he would give his report tomorrow if everyone was okay with that.
Yeah, I just wanted to mention it real quick. And then is Marka. He was, but I don't see him.
Yeah, I think he's gone again. I know they're having so many technical issues because of the weather up there.
Okay, well, we'll try again tomorrow, or if he comes on later, we can try that. Okay, Dawn, would you like to give us an update on employment first?
Absolutely. So this is Don Lyons, and the Employment First Coalition decided to call itself, oops, let me let Saber in here so we have form. The Employment First Coalition finally decided to call themselves a coalition officially because that is technically what they are. So that they're now officially named the Employment First Coalition. And as you may know, the SILC had actually had a subcommittee where I had created a draft executive order on Employment First a long time ago. And so I had brought that back to this coalition, and we kind of made it more generalized so that it could apply to any governor, because at the time it was a different governor. So we did submit that to Governor Lombardo, and it looks like his team is on board with that, which is awesome. It's just a matter of getting the executive order out, and the coalition also submitted a letter to the Go Win, which is the Governor's Office of Workforce Innovation. I don't think I forgot any words in that. And the new director, we sent him a letter asking him if he would work with us to incorporate Employment First into the new strategy for workforce innovation. And Voc Rehab, of course, has expressed that they're also interested in backing us and giving us their support on that. And so working together with all these really important entities that can really push employment first for people with disabilities in Nevada forward is exciting. It's just, a little slow to progress because of the holidays here, but we are really moving along, and we're also planning on, because we weren't able to, with a short time span, create employment fairs last October, because I think we had like a month's notice when Anthem brought the idea to us. We decided to go ahead and do that this year, and we would really like to work with the Centers for Independent Living on that. And I know, Dee Dee, we had talked about this in that we're going to do one in the urban areas in the north and the south first, and then take what we learned from that and incorporate it into the rural areas. So we go into the rural areas more informed and hopefully have some employment fairs in the rural areas as well at a later date. But we are excited about that, and we're excited about the collaboration. We haven't heard anything back from the Go Win department yet, but I'm gonna, as soon as we have that executive order in place and I get that notice, I'm jumping on it right away. I'm gonna reach out to them again and say, hey, we sent you a letter. We have this executive order. What do you think? And so we're on track to really making some progress here. And so it's exciting. It's exciting for our community because Nevada has been trying to get this off the ground for so long, and it's called, of course, called not employment first. It's been, and historically we've called it competitive integrated employment, right? But employment first sends the message that we want to send in this regard. So I think we'll make a lot more progress with this messaging. And I look forward to hearing anyone who wants to join our coalition meetings, reach out to me. I can always send you an invitation. Right now we're not like an official commission or council or nothing in statute or executive order yet. So we're not necessarily an open meeting law compliant council. So we were able to get a lot done really fast. Not saying that there's anything wrong with open meeting law, but but yeah, we've been able to make a lot of progress, a lot quicker than just it's been really encouraging. So if anyone wants to be a part of that, let me know. And if anyone has any ideas, let me know. Also, the other thing we've been talking about, and if you don't mind, Julie, I'm gonna combine this update with the discussion regarding the potential 700-hour program improvements.
Yeah, that makes sense.
Because we've been talking about that too. And I've been drafting some new language for legislation for NRS 284.327 and for NRS 284.215 and 284.290. And those are all in relation, they all mention the 700-hour program. So I had to, include all of those, but mostly what I wanted to do was incorporate language because we've had some feedback, especially at the Voc Rehab town halls. We heard from the DD Council and some members of the community that what's happening with that program is because the state has a 1-year probationary period and Social Security benefits end at approximately 9 months. People are losing their benefits and then being let go at the end of their probationary period, and it's really putting them in a huge pickle. And and I say that in a lighthearted way, but it's a big deal. So people are upset about it. They're discouraged by the program. They're afraid to use the program because of it. And so I'm hoping that with the language I'm putting in, and I've talked to Voc Rehab about this, and I'm hoping to get their support and backing on this as well as we move forward into legislation, that we can get a champion to put this out there, maybe Assemblywoman Brown May or someone else who's a disability community champion, to really help us get language in there that can help define the probationary period a little bit differently for 700-hour program participants so that they don't lose their Social Security by the end of the probationary period, so that just before that 9 months is up, maybe a couple weeks before that, they have a probationary period finalization and they actually have mandatory evaluations before that, so they know what they need to improve, if they need to improve anything, so that they can make those efforts just like anyone else. And then at the end of their probationary period, if the state chooses not to hire them as permanent employees, they still haven't lost that opportunity to keep their Social Security benefits. So that's the intent. And I just wanted to let you guys know about that and make sure that you guys were on board as the SILC, and that I can speak for you in that regard, if that's okay.
Dawn, this is Peter. You can add me to your list. I just had the opportunity to read that letter and that draft executive order that you sent. It's my fault for not having done so before, but I plan to have make some comments on it. Then I realized that the letter had already been sent and the draft has already been sent as well. But I'm interested to be a part of this informal committee pending it's been formalizing in any other way. And I agree, as I look at the 700 hour, as you mentioned just now in terms of probation, one of the things I didn't see there, it may be there, but I didn't see where any deficiencies or discovered during probation that the appropriate training be given to correct those deficiencies before the evaluation, the performance evaluation is completed. There has to be the related training done in order to complete the evaluation process. So I'll save other comments until we have a more substantive conversation, but suffice it to say that I would appreciate you including me on your team for the employment first, which I suspect also dovetails into the 700-hour issue as well.
Thanks, Peter. This is Dawn. Actually, in that first NRS, at point, there's a numeric points, and the second point says a person with a disability who is certified by the rehab division must be placed on the appropriate list for which the person, is eligible. Each such person must possess the training and skills necessary for the position in which the person is certified. So it does mention training. However, I think, and maybe we can talk about this more behind the scenes, but I think that when we have the proper evaluations and feedback happening between supervisor and probationary employee or 700-hour employee, that feedback given is part of that training, and it counts as, here's what's expected, here's what you need to improve if they do, and here's what you're doing right. And then at that point, by the end, because I think there's three that I suggested, three different evaluation periods during that probationary and 700-hour program period, where during those three, if that person does not meet their probationary period at that point, they know why. It's not going to be a surprise, right? And so they can request the training, and because they're working with vocational rehabilitation, Voc Rehab can step in and say, hey, my client needs more training in this. They've expressed that to me. Can you help? So that's something that the 700-hour program, I believe, already does, or is supposed to do, I should say. So I'm not sure if we could add more language to strengthen that. Maybe you could provide some suggestions if you think that's the case.
Yes, I think so. I read the document, and it seems to reference training pre-hire or coming on board. My thoughts were that during the training period, through the evaluation period, you would have discovered that as much as the participant might have had training for the position, during the probation period, there's some deficiencies discovered. And my thoughts are that specific to those deficiencies, a part of the corrective measures taken should be including training specific to those deficiencies that can be evaluated in terms of completing the probation period. So, but as you said, we can have a conversation in more detail. We're on the same side on this one.
Yes, definitely. And I'm not arguing with you, but I do know, speaking as a state employee, that there is quite a bit of mandatory training at the beginning of that probationary period. And there are different due dates for those trainings as a state employee, depending on which division or which unit you're being hired onto. That even includes more trainings that are mandatory. So it may be a little bit overwhelming if we add more to it, but I understand where you're coming from, and we can definitely talk about that. And I will put you on the list.
Okay, thanks.
Mary, I think you had your hand up next.
Yes. For the record, this is Mary Eaglesizer. Don, I'm going to take a slightly different perspective. I don't know if this will help or not, but there are some Social Security work incentive regulations that are put into place. Each individual that receives Social Security has a 9-month trial work period. When an individual goes to work, they can ask for their records from Social Security, and it's called a BPQI. An individual can ask for a copy of a BPQI. It's a benefits query. The benefits query record will tell them how many months of their 9-month trial work period have been used. Let's say they've tried to work before. But let's say a person goes into the 700-hour club and they haven't used any of their trial work period. Well, per the work incentive program, each individual is guaranteed 9 months, as long as they can earn over the Social Security threshold during those 9 months. And during training, you earn very little, but you can earn over. After that, Social Security is not supposed to take away their benefits, because after that they have what is it, 2-month evaluation period that their check's not supposed to be taken away. If they stay on the job, they have another 5 years where Social Security monitors and watches them. So I'm really taken aback to hear that people on the 700-hour club are losing their Social Security benefits after the 9-month trial work period. So it would help. And I know that Voc Rehab knows about the 9-month trial work period and the 2-month extension, and then the 5-year monitoring. But if we could educate individuals, if no one's going to advocate for them, to advocate for themselves, get a copy of their BPQY. That way, if they are let go after 9 months, Social Security really should not be taking away their benefits.
So thank you, Mary. This is Dawn. I really appreciate that feedback. In fact, there are nuances of Social Security that I do not understand. And so your expertise is really important in helping me understand how this will work. So can I get together with you outside of this meeting to go over some of the specifics of how that's worded and just ask you some questions?
And then we can pair up with the WIPA in Denver. One of the ways to avoid losing your check after 9 months is when the individual starts the employment period, is to go ahead and get processed through WIPA. The WIPA program can also get them their BPQY, but they're empowered to get it themselves too. And then to start tracking and monitoring, and then watching that 9 months, because the benefits should stay with them. And if they stay working, they get another 2-month trial evaluation period, and then the 5-year. So let's talk about it. I'll show you where those regulations are. But if we could marry the two programs, the WIPA and the Voc Rehab. But in addition, I know VR counselors receive some training so that they can also help to advocate for that.
Well, I guess the biggest thing I'm curious about now is where if they were not hired on as a permanent employee at the end of that, however long probationary period before they lose Social Security benefits, let's say, and then they got another position on the 700-hour program and restarted that time over again, would that time not start over with Social Security?
No, because the 9-month trial work period, that's something that you get once. So if they've used it up when they start the 700-hour club, then that might be that they're out those 9 months. But for the ones that aren't, they shouldn't be losing their benefits. And also with Social Security, as far as the benefits reinstatement go, they should be able to apply or be reinstated. Traditionally, if an individual is not able to perform the essential functions of their job, it's because of a medical reason, of a threshold. Something is going on that's creating a barrier towards employment, and not to lose those benefits, because they're hard to get back. Once you lose them, then you have to reapply all over again. So let's talk about how maybe we can just interweave those at the beginning, so that's not happening to people.
Yeah, and it may be an education problem. Maybe, people just don't realize the steps that they have to take to begin with to make sure that they don't lose their benefits. So maybe that's something that we need to emphasize as well. And, besides, looking at legislation. So I appreciate that. Thank you. I know Mark was here earlier and I think he had his hand up, but I don't see him anymore. And I'm guessing it's because of that darn wind up north. So maybe he'll join us again. But Dee Dee, do you have a question?
You're muted.
Dee Dee, you have your hand up?
Yes, this is Dee Dee Formaster for the record. I just want to say that Mary is right on. There is things in place so that even if they continue their work program after the 700 hours or after the 9-month trial period, they can still keep their medical coverage. And I would like very much to be involved in this coalition. So throughout the years, I have had a lot of training in this area. So I would very much like to work on this coalition. And Mary really does have the insight that you need to be able to move forward on this and also have that intricate part with Social Security being involved. It's important that Social Security is carried along the way, because if you do not have them working with you, they will definitely work against you. No doubt about it.
Yeah, thank you, Dee Dee. This is Dawn. I'll add you as well to the invitation list. And I appreciate everyone's input and everyone's ideas and thoughts, because like I said, I'm trying to do this, but I think we need an expert. I think we need someone who can help us with that information. So when we're, and we've got Catherine on the coalition and from the Dee Dee Council, and a couple other really, really helpful and knowledgeable people on our coalition, but none of us really understood what surrounds that necessarily, that are present. So I appreciate that from all of you, including you, Peter, about the training, because that's something definitely we need to think about. So thank you.
This is Dee Dee Formaster again for the record. I do want you to know that I have a young man who went all the way through this process, and that was back in 1998. He is still successfully employed with the state of Nevada. And so he might be able to give you some real insight as a client going through that, what it was like. So,
well, we would love to invite him to our next Employment First Coalition if you think he would like to tell us his story.
yeah, I'm sure he would love to, because he also has served on the DD Council for quite a number of years, but he is a wonderful success story and a very amazing man who, yes, has a dual diagnosis, so which is also something that was very much in those days ignored. So
okay, well, if you wouldn't mind asking him and bringing him to our next coalition meeting, I'll send you that invitation and you can forward it.
That's great, but he does work 8 to 5 for the state.
Okay.
Thanks so much.
Thanks. And I think that's it, Julie. I don't see anyone else.
Great. Thank you for that really productive conversation. There's a few people that went to that April Congress. Does anyone want to tell us about their experience?
This is Dawn Lyons. I know I'd like to hear from Peter and Dee Dee.
Yeah,
Both of them went to April.
April was a wonderful experience. I learned lots of information.
Can you share with us any specific takeaways that would be helpful for SILC to know?
Well, I can tell you that I sat in on one really wonderful speaker who taught about grant writing. And she had a very wonderful perspective on how to grant write. And there was a person there who kept interrupting her all the way through the presentation. So she did not make it through the presentation, but I did send her an invite to turn in a presentation to the conference coming up, and told her that we would very much like for her to come and have the opportunity to finish presenting a grant writing proposal. She writes grants a lot like Sandy and I used to, which was not an individual situation, but rather a group input into grant writing, which really is an absolutely wonderful way to do it. And also, a lot of the networking that I did at the April conference, and a lot of sharing that they gave us time to network, which really needs to happen at a lot more conferences. But they actually allowed us to have time to network, and that network time was absolutely wonderful. I learned about the concepts of what other states were doing. That's how I learned about money follows the person, and a lot of states that are incorporating that into their CILs to be able to shore up the staffing as well as the money situation. I also had a huge opportunity, which was wonderful after years of working with Pacific ADA. I finally got to meet the lady behind the conferences that I had with her. And that was a really wonderful experience. They had some very informative breakout sessions. And I do encourage everyone to attend the April conference because it is so full of wonderful positive energy, as well as information, especially pertaining to rural areas. And I'll let Peter jump in here too.
So I was encouraged to attend the conference primarily because I wanted Sophia to be part of that youth development piece. And as it turned out, she wasn't able because of circumstances, and she wasn't feeling well. Like so many people weren't feeling well, and I think some of us may have aborted our trip to the conference because of illness as well. I didn't anticipate making a report back to this conference for what I learned there, but I spent most of my time getting to know individuals in the business of servicing the disability community. This was my first conference as a representative from SILC. And like Didi, I was more interested really I found more interest in getting to know individuals and sharing ideas about our different service population. One of the material things I took from there's an organization, and it's slipping me as I speak, but they have a automated system that manages the interior, the organizational systems and processes in a nonprofit organization. It's an automated information management system, I would describe it as. And the framework that they had has informed me, and now to set up a new system in the Down syndrome organization. So that was rewarding for me from an organizational perspective. But I appreciate the opportunity attending on behalf of SILC.
This is Dawn Lyons. I'd just like to say I appreciate both of you sharing that information, because whether you think it or not, networking is one of the biggest benefits of going to those conferences. And so learning about what other states are doing, learning about what other disability communities look like, that's huge. And so that's not just, you know, novice behavior. There is just exploring that's part of being a SILC member. Very important part, I think, because the SILC needs that information. So I appreciate you sharing that. Thanks, both of you.
Yeah, thank you.
I do want to add one more thing, Dawn, that there was a wonderful breakout session about justice, the justice system. And we had a rather lively discussion during the piddly 2-hour time period, which we really needed a whole half a day to explore those areas. But they said that with all of the encouragement that all of the people in the breakout session gave them, they are going to come back next year with a full 4-hour session where people can really learn a lot about the justice system and make so that we can make our clients more comfortable with dealing with the justice system. Because I know that one of the biggest things that we do here out of our office is we go to court often with people who are scared. They're extremely fearful of the justice system. And I think that people with disabilities need to learn more about the justice system so they can become more comfortable with it. And that was the other breakout session that really had a big influence on me. Thank you, Dawn, for your time.
That's such an important subject, and I don't think it gets discussed as often as it should. So thank you, Dee. Are we ready to move on?
I think so. There weren't any other conferences after the April yet that anybody has attended. They're coming up.
Yeah. Okay, Jennifer. I'd like to invite Jennifer to talk about the Department of Ed's Disability Initiative. But
Thank you, Julie. This is Jennifer Kane for the record. Oh my goodness, a lot has happened since we talked to you last. I think we shared with the SILC just the fact that we were super excited the last time we met because we had recently found out that we had been awarded with it's almost $10 million from the Disability Innovation Fund. And there have been A, B, C, D DIF projects before ours, but ours is E, and this one is specifically called the Pathways to Partnerships Model Demonstration Project. And they were asking states to bring together a bunch of required partners, and we went beyond the required partners and brought in additional partners like the Nevada Statewide Independent Living Council to get us to a place of more truly seamless transition. Again, the target population that this grant serves is children ages 10 to 13 and youth ages 14 to 24 with disabilities, as well as their support systems. So that would include families and others that support the students, as well as all of the service professionals across all of the different realms that serve children and youth of transition age. And so last time we met, we were just super excited to share with you that we had been awarded the funds, and boy, have we had our work cut out for us since. The joke among the states that received this is you have that moment of, we got the grant, and then you have the moment of, oh my gosh, we got the grant, because as you can imagine, getting to a place of truly seamless transition for students and families and service providers is something we have aspired to for many, many years within the Individuals with Disabilities Education Act, and they wouldn't have created a fund to help us get there if anyone had figured it out so far. So we definitely have a huge undertaking before us, but we, as we always do in Nevada, when you start talking about secondary transition for individuals with disabilities, the tables that we sit around become smaller and smaller because there are those of us at our different institutions or organizations that serve this specific population. And so just as a really brief reminder for those of you who may not have been here at the last meeting, the required partners were the State Education Agency, that's us, the Nevada Department of Education, Office of Inclusive Education, and then Nevada's Vocational Rehabilitation, along with local education agencies, and then our federally funded Centers for Independent Living. You had to have at least one local education agency. We have 3 that we'll be piloting with: Carson City, Humboldt County School District, and White Pine County School District. And then you had to have a minimum of 1 federally funded Center for Independent Living. Since we have 2 in our state, we elected to bring both on board because they serve really different populations across the state. And then, like I said, we chose to bring in additional partners. We invited our friends at ADSD to the table, and while they helped us develop the entire grant on the timeline with which this had to be turned around, they ultimately didn't end up being one of the 9 partners, but they have committed to doing the work with us moving forward. But then the additional partners are, like I mentioned, Nevada SILC, us, as well as the Nevada Center for Excellence in Disabilities at the University of Nevada, Reno. They engage with us in our Nevada Student Leadership Transition Summit efforts and have for the past 16 years. And so we wanted to bring them in so we could bring that work into the grant, but also expand that work as well. That's all aimed at empowering transition age youth with disabilities in Nevada with leadership skills to help them not only create positive paths towards future positive outcomes in post-secondary education, training, employment, and independent living in their own lives, but they also do a bigger service back to their schools and within their communities of creating a space for disability pride for students on campuses in middle and high schools across Nevada. So we were excited to be able to bring that work into the project and have some ability to expand it with the funds that were available. Let's see, who are other, Nevada's Parent Training and Information Center, Nevada PEP. We have so many partners. If I don't have the list in front of me, it gets hard to remember who everyone is. But we have some great people at the table. Those folks helped us determine what was needed to get past the barriers that present themselves to get to seamless transition. So they were part of coming up with our innovation, our innovative model of how we wanted to try and tackle this as a state in Nevada. And so we, as part of the grant, we are required to create a website. We also elected, as part of our innovation, to develop an app. You heard Mary Evilsizer talk about that earlier. That will, our acronym, because nothing exists in our world if there's not an acronym for it, is the Nevada Transitions Roadmap through Innovative Partnerships. So as you heard ADSD present earlier about their conference, they have a strand of their conference called Innovative Partnerships or something along those lines. So when we saw that, we were like, oh, that probably is somewhere we need to go and share this information. But since Congresswoman Lee announced for us that we received the grant back on September 13th, we have just hit the ground running. It feels like a lot of the first couple months has been all of the fun red tape that you deal with as state agencies when you're receiving, you know, a giant federal grant. And so a lot of the work that we have done has been things like all of the internal paperwork required, both ourselves at the Nevada Department of Education and our collaborators and partners at Nevada's Vocational Rehabilitation. We put in together 2 work programs to bring the money into the state. Both of those, I'm happy to report, were unanimously approved at the December 13th Interim Finance Committee. So that was like a big celebration day for us. You know, you wouldn't think the Interim Finance Committee would not want $10 million to come into the state and 4+ of it to go to VR, but you just never know until you get there. So there was relief involved in having that jumped past that hurdle. And then the other thing, we need to be able to subgrant out to our 9 partners. And while many of our 9 partners are people the Nevada Department of Education regularly subgrants to, like local education agencies, there were partners like the SILC, for example, that we had never done that with before. So a huge part of what we're doing right now is having them do the paperwork and go through the process of getting into our ePage system, which is our electric grant system here at the Nevada Department of Education, because as our federal partners shared, these grants are very visible on the Hill, and so they require 100% transparency. So we have monthly reporting requirements of all 9 partners to show our spend down, how the funds are being used, who they are impacting, how they're impacting those people, how those people are receiving the things that we're putting out. So there's a ton of transparency, but there's also a ton of support through our federal partners at the Rehabilitation Services Administration. And then they partnered with a company called Mathematica, who are their evaluators. So we have had, we've now established our regular monthly meetings with our federal partners, and they have had to revise some deadlines because they were supposed to get us things like in November that we didn't get until just January. So that they have kind of backed out some of our deadlines for the cooperative agreements, and we've got memorandum of understanding that we're working on with the Nevada partners. So kind of some big highlights. I could literally talk about this all day, and I know we've been in this meeting for 2.5 hours at this point, so I won't go on too long. I'm happy to answer any questions anyone has, but our next big meeting of all 9 Nevada partners, facilitated by the Department of Education, myself as the project director, and Ashley Price, my colleague, as the co-director of the project, will be on January 23rd. And we will be working with our partners to go over all the processes related to them, finalizing their paperwork and what is needed to get in our ePage system so we can get the money moving, which is what we need to do to start, because many of us wrote positions in, wrote people in, wrote in things that we've never had money for. I can't tell you how many times I heard, and I've now begun to understand from our federally funded Centers for Independent Living, they're like, we have an unfunded mandate for these transition age children and youth, right? So, well, now we have some funding. So we're really excited to build independent living philosophy into every single training that is developed for children, for youth, for their support systems, and for the service providers in ways that we've never had that level of engagement with that independent living philosophy before. And starting, you heard me say, at age 10. So in my entire almost 20 some years of career that I'm at now, you know, working with transition age youth in the education system, I get down typically as low as about age 14. And so this, you know, being able to look at helping students and families prepare for transitioning from elementary to middle school for the first time, that is super exciting work to me. And new and innovative work that we're going to get to engage in and be on the front lines with 20 or 19 other states who are attempting to do this work. And then everything we do in Build and Learn, we share with the other states and they share back with us, much like Peter and Dee Dee were talking about, that networking aspect of, we don't always have to start from zero. Sometimes we can learn from what other people have done and take their ideas and make them work in Nevada. And so we could not be more excited about this. Also a bit overwhelmed, but we are getting there, and we are excited to meet with our partners on January 23rd. Bring everybody fully up to speed now that we know more kind of post holidays. We just on Tuesday had our monthly meeting with our federal partners, and it was also our quarterly evaluation meeting with Mathematica. So we learned a ton just this week, and now we're ready to turn that information around and share it out with the 9 partners on the 23rd. So Dawn had asked if I'd be willing to kind of just share updates like this every time we met as a SILC. And if that's something you all are interested in hearing about, we are more than happy to share that. I think Dawn shared with you all last time that part of the reason we wanted to bring the SILC in is we really wanted to fund the Youth Action Council position through these funds so that it was more sustainable, so that we could perhaps offer some additional money and make it a more permanent position, and hopefully, you know, bring someone in. And it sounds like we're going to meet someone. Is that right, Dawn, tomorrow? So
Yes.
Even though we haven't got it all up and running yet, we're already seeing some positive benefits of the work and the collaboration together. So if we can figure, if I've got like about 10 years left in my career before I retire, and I'm feeling like if we can get to a place where we're anywhere closer to seamless transition than we are today, we're going to be doing a really good job with this grant. And so we're excited that for the next 5 years, the focus will be on ages 10 through 24, but all of the partners have committed that following the grant period, when we sustain these funds with vocational rehabilitation funds, with the Individuals with Disabilities Education Act funds through the Nevada Department of Ed, and the Workforce Innovations Opportunities Act funds through Nevada Vocational Rehabilitation, we want to make this be birth through life. So this grant and these 5 years are going to get us there, hopefully, with ages 10 through 24 and their support systems, families, and service providers. But it is our ultimate goal to make it truly lifespan seamless transition place for Nevada, so that that website and that app will serve everyone's needs. And we can't get there without all of you. So know that if you weren't in the original build of this 10 to 24 age group, I mean, you all are as members of the SILC, of course, but know that we will be coming in, you know, looking to work with you as we get further along and expand that timeline as well. So I'm totally happy to answer questions. You can ask Dawn. I could literally talk about this all day long, but it is 3:38 and I know we have a meeting end time and some items left. So that's it for me, unless anyone has any questions. Thank you for your time.
Enjoy.
This is Dawn Lyons. I just wanted to say first that Obioma said in the chat, that would be amazing! Exclamation, exclamation, exclamation. Congratulations on this new beginning. Thanks, Obioma. I'm actually...
Dawn, you just...
I just muted myself. I'm so sorry. Yeah. I also wanted to say I'm also very excited about this, and it's also encouraging to hear your enthusiasm and Mary's enthusiasm, and everybody is just so excited to get this ball rolling and get this progression going, and I have so much optimism about this, and I anticipate it being amazing too. Yes, we just hired a youth outreach specialist, and the good thing is that the SILC already had some funding already in place to get this position started. So it's not like we're waiting on the Department of Education grant yet, but we will use it. and we did also get the DD Council award as well. So that is helping us too. But yeah, I'm really excited, and I think you guys are really gonna be impressed with Riley when you meet her tomorrow.
Any more questions for Jennifer?
Obioma. This is Obioma for the record. Maybe I missed part of that. I'm sorry, but will that include the deaf and hard of hearing community as well? And then focusing on some specialists for the deaf and hard of hearing?
Yes, so the grant is for all students with all disabilities, whether that vary from, you know, students with very mild support needs all the way up to students and children and youth. I should be using students as my education side of me talking, right? Children and youth. And so everything that will be developed on the app and the website will be accessible to all, including in multiple languages, as well as screen readers, anything of those sorts. We are changing how we have done all of our training. We used to, you know, have a long tradition of, if you're a teacher or a VR counselor or a service provider, this is the training you get. If you are a parent, you probably go through Nevada PEP and you get training that they created. So we're going to just blow all of that up. And we are going to create one training that is understandable by everyone, from the children and the youth to their families, to all of the service providers and their support networks. And so everybody gets the same message. And then our plan is to provide it in as many formats as possible. So while a lot of this information will live on our roadmap, which is kind of, the app is just like a, you know, fun app that kids would pay to download or whatever. It will be free, of course. They are going to go on their Nevada Transitions Roadmap through Innovative Partnerships Journey, or Nevada Trip. They're going to start by selecting a car, and they get to pick if they want an, you know, all-terrain vehicle, or they want a speed, you know, kind of car, or what they want. And then they're going to get to move through the roadmap. Depending on their age, there will be different kind of touch points. And then they're going to get to pick if they are in urban terrain or rural terrain. Is it mountainous? Is it, you know, and so it will they'll truly get to build their trip to match their individual needs. And then they'll get to navigate through those touch points, having, so the vision is that they'll go into a town, and in the town will be a movie theater. And so in the movie theater would be where they access videos, whether you're, you know, an educator, a student, or a family member, on the topics that would be meaningful at those different kind of touchstones across the ages of 10 to 24. And so, you know, we're talking about, you guys probably are as aware as I am, watching all the stuff, new information come out about ABLE accounts, for example. So, you know, at what point would students and families need to be, or children and youth and their families need to be made aware of that on kind of a more, you know, broad level? And then at what point would they need more specific information in order to actually, you know, open an ABLE account and begin that process? And so every single aspect of all of the things that we're going to be developing for those touchstones along the roadmap, all of that information will be presented the same way, no matter who is accessing it. So there won't be different messages or different information given to different groups to try to level the playing field. And it is our goal with the marketing team that we put in as part of the website and the app and the Nevada Trip, that by the end of this 5-year cycle, when it has been rolled out statewide, that any time you're at, you know, you're meeting with ADSD about regional centers, or you're meeting with a VR about becoming a client or having pre-employment transition services, or you're at an IEP at a school, that every single one of those places will be talking about Nevada Trip and sharing the same resources that were developed in common by all of us, with the underlying philosophy of independent living as the, you know, the ultimate goal, and that philosophy kind of guiding everything that we do. And that has been a huge missing piece of why we haven't ever gotten a seamless transition, because, you know, we haven't brought Centers for Independent Living into these grants. This is the first federal grant that I'm aware of that they have required federally funded Centers for Independent Living to be partners. You couldn't apply. So they've figured out that we're leaving those folks out, and that's part of the reason we've never gotten a truly seamless transition, and they're right. So anyway, like I said, I can talk about this all day. I will be happy to share, or Dawn will, my email address if anybody wants to have, you know, more information about this, or how you can connect to the work as we build and grow the project over the next 5 years, and then ultimately beyond. We are certainly, we know that to get to seamless transition, we need everyone to be part of building it. So thank you for your question.
Dee Dee, I'm gonna ask you to keep this short because we need time for public comment.
I just wanted to say that I love your enthusiasm, and I'm excited for all of my transitioning students to be able to engage in this program. Thank you.
Thank you. Yeah. Your enthusiasm is amazing at 3:40 in the afternoon.
Julie, Opioma wasn't finished. She just had one more thing.
Oh, sorry, Opia.
This is Jennifer Kane for the record. Oh, do you want me to just read it from the chat? Is that okay? Or do you prefer? Go ahead.
Obiama said, yeah, this is Obiama for the record. I just wanted to add one more thing. The importance of the deaf and hard of hearing being involved from the beginning. So if you have anything from the deaf and hard of hearing specialist or department that you want to pull them in and have them be part of the discussion while you're developing this, I feel like that would be so important, because as an afterthought, it will be, a lot of things might be missed. So it might be better to have them involved from the beginning.
This is Jennifer Kane for the record. Absolutely. Sorry, I never even finished answering your question. So on January 23rd, in this first large meeting with all 9 Nevada partners, we're going to talk about, there's a requirement within the grant that we have an advisory work group, I think is the language. And who is going to be on and invited to the advisory work group will be determined, or begin to be determined, in this meeting on January 23rd. And in addition to my full-time role as the secondary transition person here at the Nevada Department of Education, I also happen to co-facilitate with my partner at the University of Nevada Vision Services team meeting. So I'm really linked in with that group, but I'm not as linked in with the DHH community, just because it's not one of my assigned roles. So I would love for you to reach out and share with me who you think the contact person would be, because as we begin to develop who will be on that advisory work group. Is that you? Perfect. So we need that expertise at the table from day one. So we will be determining who to invite in January and February. And we are hopeful that we get enough people to have a quorum for a meeting in either April or May. So you have not been left out. We're going to include you from the beginning. We just need, people to help us understand who those people would be. Done.
Yeah, this is Dawn Lyons. I just wanted to quickly say, I believe that vocational rehabilitation had a deaf community representative to begin with, but I don't know that they do anymore. So I appreciate that you're stepping up, Obiama, because I'm not sure that we have that in place anymore. So thanks.
Yes, Voc Rehab had one before, but they currently have a deaf and hard of hearing team there that's providing services for the deaf and hard of hearing in our state. So if you have already partnered with them, then go ahead and continue that partnership. I can give you that contact information if you need that. I don't have it with me right now, but if you need other people involved, yes, so I do have that contact information with me right now. I could give to you. If you need other people involved that are not Voc Rehab, I have contact information for them as well.
This is Jennifer Kane for the record. Thank you so much. So Voc Rehab is one of the partners of the $10 million. 4.5 of it is going directly to them. They're going to do they've put out the RFP already for the website and the app development, and they're also hiring the marketing along with that. That will be our rollout marketing. And so I will just simply ask, I have a meeting coming up with them. We meet monthly, Department of Ed and vocational rehabilitation have regular monthly meeting outside of even our Nevada trip meetings. So I will just find out from them if they have thought through that piece and if they have somebody that they are thinking would be great to sit on the advisory work group. But I also think it would be beneficial to have somebody from outside of that that is connected in different ways to that community be present. So there is no limitation to who we can have. We get to choose. I mean, we can't have 150 people on the advisory work group, or we're going to have issues getting quorum and it's going to be hard to get anything done. But simply bringing in one additional person with that specific expertise makes a heck of a lot of sense to me. So, and I'm the project director, so we can talk. Thanks, you guys.
Great. Beautiful. Thank you.
Okay. It's 3:49 now, and we have to end. asked for. So I'd like to ask Dawn to once again read the preamble for public comment.
Sure thing. This is Dawn Lyons and public comment. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782 US Tacoma. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments.
Is there any public comment? Mary?
Thank you, Julie. For the record, this is Mary Sizer. I'd like to share our campaign to recruit candidates for our board. We have a couple of skill set positions that are available on our board right now. First, we look for individuals that are very interested in promoting the independent living philosophy. And we look for individuals that have personal experience with a disability.
Now unmuted. Leaving menus. Meeting tools.
And what we're looking for right now is a skill set of HR, human resources. We take our employment handbooks and following the regulations for employment very seriously. And then what we're also looking for is an individual that meets all that criteria with business law. So if any of you know any of your colleagues or peers in the community that have a passion for the disability community, that have expertise in those areas, we'd really like to invite them for an interview. I am going to be posting up on our website. It's a fact sheet on what's required for a board membership. And then the types of skill sets that we're looking for. So thank you.
Thank you, Mary. Dawn?
This is Dawn Lyons. I'd just like to let everyone know that Jennifer Kane put her email address in the chat if anyone needs that information or would like to reach out to her. And Mary, if you would like to send me the recruitment information once you have something a formal, I can send that out to our listservs as well. Thank you.
Thank you.
Any other?
This is Mark Tatter.
Hi.
I think I'm unmuted now. Hooray. It's MARKTADDER for the record. I'm the Associate Director at the Northern Nevada Center for Independent Living, and I'm not sure what's going on with my computer, but I apologize because both the video and the mute, I couldn't unmute it. So anyway, I think you had said I could present tomorrow sort of our update for what's going on at our center, and I'd love to do that tomorrow if Lisa's not available.
Oh, great.
And I'd love to talk to is it Julie or Jennifer? Jennifer. A little bit further about this program, as I have some ideas. I'm also the president of the National Federation of the Blind of Nevada, and I'd like to have some representation in this meeting as well. We work with a lot of students. We do things like the Bell Academy, which teaches kids and enhances their Braille skills in the off school time, and we'd like to be, at the table. Got a lot of expert support, so I can get that email from somebody, and I'll be able to figure it out. So sounds like everybody's voiceover is talking at me right now. All right, thank you guys very much. It was a nice meeting. Thanks.
Thank you, and we look forward to hearing from you tomorrow. Cindy?
Yes, this is Cindy Swanson for the record. Mark, I'm sorry my voice was talking to you while you were talking, but I had to get unmuted as fast as I could. I'm very excited that Mary and Dee Dee and I think Peter want to be part of the Employment First collaborative. I've been a beginning partner of Employment First, I hope Jennifer Kane listened to all the good things that were talked about. For example, people on 700 should not be
From
losing
Jennifer
Social
Kane, NDE,
Security.
everyone, yes.
There are so many errors that are being made because of people not understanding. I'm thinking some of those folks on 700 might have been taking medicine, might have hearing aids, and all those things are impaired related work expense. This community doesn't know those kinds of things. And Jennifer, when you're talking about people at 10 years old, yes, absolutely. We have to get them ready to understand that they're going to be working and their parents need to know the best they can. So I'm so excited about what you're doing. And while I'm a volunteer, I would love to be on that table. Thank you so much for all your good work.
From Jennifer Kane, NDE to everyone, wonderful.
Any other public comment?
This is Dawn Lyons. I just wanted to mention that in the chat, Jennifer Kane typed wonderful. I look forward to collaborating with you, Mark. Mark, I can send you her email if you can't get it from the chat. Also, Obioma says Jennifer email has been sent. Looking forward to chatting more. And of course, Jennifer is just excited. She's saying wonderful. So I just wanted to share that because those were the voiceovers, some of the voiceovers I think that were interrupting Mark. Sorry about that, Mark, but I wanted everybody to be aware of that who didn't see the chat.
Any last comment? I think this is Julie Weissman's time out for the record. I think this is a really productive meeting. And I'd like to thank everybody for their participation. And now we get to go rest and do it all again tomorrow. So let's see you tomorrow at 1 o'clock.
Thank you, Julie.
Thank you.
Thank you.
See you tomorrow. Thank you. Thank you,
So
interpreter.
I'm assuming that means adjournment, right?
Over.
Thank you.